Talofa, and welcome to all those who are here today on behalf of the NHPI 3R team. We just want to give everybody a couple minutes to come in, but recognize all of you and thank you for coming. Continue to see the numbers. We'll start at 12:05 just to give everybody the time to join. Welcome to all those who are just joining us. We will start at 12:05. We're so happy to see so many attendees today. Happy Wednesday. All right, we're going to go ahead and get started. So aloha, talofa to all of those who are attending today. My name is Chantel Matani. Everybody calls me Telly. I am the NHPI 3R coordinator, and I will be your host today. So thank you for joining us. We are looking forward to our project. So just a little bit, or our project presentation, just a little bit of housekeeping. This webinar is being recorded and live streamed, so just be aware of that. Also, if you have any questions, we ask that you put them in the Q&A portion. We understand, a lot of people like to use the chat, but it is easier for us to maintain it if we have it in the question and answer area. And for those of you who are live streaming on Facebook, please feel free to post your questions in Facebook chat, and we will then ask them of those who will be we will then ask it of the panelists. So again, thank you so much for attending today. We're going to go ahead and get started. So I'm going to be introducing today Dr. Tina Tawasosi Posiolai, who is a PhD. She is an adjunct professor at the University of Hawaii Manoa. She works with the Department of Tropical Medicine, Medical Microbiology and Pharmacology, as well as the John A. Burns School of Medicine. I have worked with Dr. Tina over the years. She does a lot of health equity work, as well as equity work in general. She's also given talks concerning domestic violence in Samoa, and she works with students throughout the Pacific, assisting them in really their journey as they come to UH Manoa and as they go through the system. So I will turn the time over to Tina, Dr. Tina, and she can begin our program today. So mahalo for joining us, and Dr. Tina, I'll turn it over to you.
Telly, thank you, Telly. And mola maona. Ato ave fa moile tua onolo na lofa malona ngane. Ia o whamata no manuia le whamoi moe ni Mesteo Hawaii Manoa, ina na sosu engal COVID-19 ma fianga onga sa ma pati ai tangata Pasifika mai tausanga dua felu spulu, ile tausanga dua felu spulu manua. Ma to te whake rai atu foi, ma muli atu le nganga whakatai le pa ia male malu. Ia umwhain whata si mai lunga o penga te whai langi, e muli mawina le lipoti, o le neisu esu enga tā ua. Aloha and welcome. First and foremost, we mahalo ke kua for his love and grace that allowed us to successfully achieve the ambitious goals of the RADx-UP Puipuia Le Ola, or protecting life study. We welcome and thank everyone for joining our webinar. We hope that our study report will bring us together to lift up the Pacifica community in Hawaii. Before I dive into my acknowledgement of people and organizations that collaborated and supported the study, let me introduce my team of brilliant presenters. We have here Ms. Samala Urulan Yuen, Elisabeth Sangape Taya, Chelsea Nicholas, our counselor and prayer warrior, Pastor Jordan Gallen, and the youngest member of our team, Dinasia Joseph, who's also an undergraduate student in Manoa. We're also grateful, very grateful to our Tangata Pasifika, or the Pacific Islander community in Hawaii for consenting to participate in the Puipuia Le Ola study. Many were understandably reluctant to participate in the study due to the very lengthy survey questionnaire. However, as we explained to them about the importance of data collection and data availability for the Pacific community, they kindly agreed and supported the study. We acknowledge and thank the hard work of Professor Rick Yanakihara, the principal investigator for the study, as well as Doctors Angela Sai, Gavin Castle, Neil Palafox, Jatura, Melissa Roman, and Corey Watanabe. Also, our partnership with the University of Hawaii was wonderful and was done in a very true Pacific Island way. The collaboration with the University of Guam was led by Professor Rachel Taitano Leon Correro, the Vice Provost, Office of Research and Sponsored Programs, as well as Dr. Teofila Cruz, Dr. Angelina, and as well as the graduate students from the University of Guam. Thank you, Dr. Correro and your team. For some who are not familiar with RADx-UP, please allow me to briefly explain what this program is all about. RADx-UP stands for Rapid Acceleration of Diagnostics for Underserved Populations, and it is a $500 million program supported by the National Institutes of Health to ensure that all Americans, but especially marginalized communities and ethnic minority groups, have equal and full access to COVID-19 testing. The Puipuia Le Ola, or Protecting Life study, was one of those 100 projects across the nation supported by RADx-UP. And our project received approximately $1.3 million. Our study was also guided by a community and scientific advisory board. Tally was part of that, which was composed of leaders in the Pacifica community and academicians who have dedicated their lifetimes to reduce health disparities among Pacific Islanders. We are grateful for you guys' support. We also have a lot of community partners, such as, I think, Chrissy, your slide is not cooperating with me. Good. We have a lot of community partners, such as nonprofit organizations, Apollo Lokahi and HPI, amongst a lot of, as shown on this slide. We also have the support from the Hawaii State and City and County of Honolulu, as well as many Pacific Islander church communities who collaborated with us during the initial field research. Thank you for your service. Last but not least, I want to thank and congratulate my team of dedicated Pacific Islander field research assistants, graduate assistants, and study coordinators for their tenacity and resilience. When they applied as employers for the field research, they didn't fully comprehend what the workload would be like and the challenges they would encounter in the field. The study took place during 2 lockdowns due to the massive surges of COVID-19 in our state. And almost everyone on this team had loved ones who passed on during the duration of the study. However, persistence and perseverance outweigh all the challenges. And we knew, and we still know, that God was with us. The study has also been a great learning experience for the Pacifica college students on our team, and no doubt that they acquired invaluable skills and knowledge that will equip them for future careers. We're very confident that our data is rich and represents the Pacifica community in Hawaii. So now I have to hand it on to my team for their part in presenting the study results. Yeah, rough type.
Talo falava, everyone, and thank you for being here today. My name is Chrissy Lambuan, and I'm Samoan, and this is our agenda for today. We'd like to briefly do an overview of the Pacific Islanders in Hawaii, followed by our RADx-UP Puipuia Le Ola study goals and results. And then we wanted to highlight some takeaways from our study. This will be followed by the testimony of 2 of our field research assistants, and we'll end with our study implications and study impact and implications. Our Guam team presentation will follow ours, and we will end with questions and answers. So, overview of our Pacific Islanders in Hawaii. Pacific Islanders comprise of 4% of the population, as you can see in this chart, 58,211. Based on the 2020 data from the Hawaii State Department of Health, out of the 4% of Pacific Islanders in Hawaii, they were the most overrepresented in COVID-19 cases compared to other racial and ethnic groups. As you can see in this graph, Pacific Islanders were heavily impacted by COVID-19. Samoans made up the highest COVID-19 cases at 1,232. Chuukese made up 1,024 COVID cases, then followed by Marshallese at 939 COVID-19 cases. This chart represents the cumulative COVID-19 related deaths of Pacific Islanders in Hawaii for the years 2020 to 2023. And just to showcase the depth of impact on the Pacific Islander population, we look to the deaths per 100,000 population death ratio. And as shown in this figure, Pacific Islanders had the highest ratio of 428 COVID-19 related deaths per 100,000 population as of 2023. So we look to the social determinants of health as a way to understand the health disparities that exist among Pacific Islanders. And social determinants of health are the conditions in which we live, work, and play that all contribute to a healthy life. So health is affected by multiple factors, not just our access to doctors and healthcare, and some beyond our own control. Health is affected by education opportunities, where we live, our community, transportation access, and having a stable income or job security. So how is this related to COVID-19, and why is it important? The best way to present COVID-19 infections is to avoid being exposed to the virus. However, all of those factors I just mentioned places Pacific Islanders in a more vulnerable position to COVID-19, which you will see highlighted in our study results. However, I do want to highlight an existing data of health of Pacific Islanders in Hawaii that impact their health. Pacific Islanders have higher rates of pre-existing chronic diseases or comorbidities, which puts them at increased risk for COVID-19, for severe COVID-19. The examples we have shown here are diabetes, asthma, and high blood pressure. The information presented in this slide is from the Hawaii State Department of Health, spanning the years 2017 to 2020. As you can see on the leftmost part of this graph under diabetes, the overall population in Hawaii that has diabetes make up 11%. However, Pacific Islanders make up a higher 17% of these cases in Hawaii. Under the asthma category, the overall population in Hawaii that has asthma is 9%, while Pacific Islanders make up a greater 11%. Finally, the overall population in Hawaii that has high blood pressure is 28%, but alarmingly, Pacific Islanders make up 33% of high blood pressure cases in Hawaii. So the goals for our RADx-UP Puipuia Le Ola studies are to increase COVID-19 testing among Pacific Islanders in Hawaii to stop the virus from spreading and to learn about Pacific Islanders' knowledge and perceptions of COVID-19. For this study, we have been very fortunate to employ Pacific Islanders as field research assistants. Our Pacific Islander field research assistants are very important in this process that you see in front of you, 1 through 5. This is how our team performed the study in the field. However, before we even started at number 1, we needed to make sure that Pacific Islanders who consented to participate were 18 years and older, self-identified as Pacific Islanders. They never tested positive for COVID-19 and will be on Oahu for 3 months. So first they went out to the community and did a pre-survey. The pre-survey was used to assess participants' beliefs and what they know about COVID-19. Next, we provided COVID-19 testing kits for participants. Thirdly, we provided education sessions to share why testing is important. The purpose of the education was to help our study participants be more aware about and reduce the spread of COVID-19 through COVID testing. And next, we did a post survey to assess any changes in participants' beliefs and knowledge about COVID-19 after taking our education sessions. We entered the pre-survey and post results in a database, and data were analyzed. And finally, and importantly, we are going back to the community and sharing the results. And this is what we are doing right now with you all. And we started this process first with our Pacific Islander communities back in November 2022. And we will continue to share our results with the community. So to start with the sharing of our results, I turn the time over to Elizabeth Sangapetaya.
Thank you, Chrissy. Like Chrissy said, my name is Elizabeth Petaya, and I am of Samoan ancestry. And in the next few slides, I'll be sharing with you variables considered in this study, such as gender, age, race, income level, geographic locations of participants, employment, household, and levels of education. These demographical information makes certain generalization about the Pacific Islanders during the pandemic. Looking at the total respondents by subgroups, we report the results from 3 Nijin communities and including other Pacific Islanders. The Nijin communities included Polynesians at 49%, Micronesians at 48%, and Melanesians at 47%. As you can see here before you, the pie chart shows that we surveyed 3,238 respondents between the months of May 2021 and January 2023. And out of the 3,238 Pacific Islander study participants, 1,248 were men and 1,960 were women, and were either identified as Polynesians or Micronesians. This bar graph shows the total number of respondents by ethnicity, with Samoan encompassing 1,404, making it the largest group participation among the study participants. And it was followed by Chuukese participants at 739. Geographical wise, the map here illustrates the tracking and mapping of areas where the study participants reside. And respondents were from various places, including Laie, Wahiwa, Waianae, Waipahu, Eva Beach, Aiea, and Honolulu. Considering where most of them came from, we found that most of them were from Honolulu and also in the Waipahu area. As we all know that as Pacific Islanders we are very family-oriented people, but we also found that overcrowdedness and multi-generational housing are dependent factors for COVID-19. Social distancing made sense during the pandemic, but it was quite difficult for Pacific Islanders who come from tight-knitted families and communities. So the pie chart before you is a perfect representation of those families and Pacific Islanders. That we also know that these Pacific Islanders and families are more likely to live in multi-generational households. As mentioned earlier, Pacific Islanders have higher rates of comorbidities and that they are at risk when contracting COVID-19, and they also have a high chance of spreading COVID-19 in the household. In that previous one, we saw that 60% of our Pacific Islander participants reported to be living with children, and 18% of Pacific Islander participants were living with either parents, children, and grandparents, or like the 3 generations. In this chart, we see that our respondents were asked if they spoke another language other than English in their home. And most of them responded yes, that they spoke 1 or more languages in the homes. Another question that was asked was, what was the highest level of education they received? And here we have a graph showing that the majority of the study participants, or 1,313 of them, completed high school education, followed by 798 participants with some college education. Employment-wise, despite the pandemic, approximately 1,734 of the total 3,238 Pacific Islander participants reported that they were currently working at the time they completed the survey. And here we see that almost half of Pacific Islanders reported their total household income before taxes to be below 50,000, which means that a lot of them live in poverty. In comparison to the federal level guidelines, a member of 7 in a family with an income of 52,000 and below portrays a Pacific Islander family living in poverty. Health-wise, the most common comorbidities among the included participants, as shown here, were hypertension at 12%, and it was followed by diabetes at 10%. And these were the 2 most reported underlying health conditions among the Pacific Islanders. We'll now turn the time over to Chelsea Nicholas for her portion of our presentation today.
Thank you, Liz. Again, my name is Chelsea, and I am Samoan on my mother's side. So the study's pre- and post-intervention questionnaires measured Pacific Islanders' awareness and testing of COVID-19. Awareness was assessed by knowledge of COVID-19 transmission, sources of information about the disease, and self-perceived risks of an infection. Pacific Islanders also responded to questions about access and intent to get tested, their history of COVID-19 vaccination and testing, and interpretation of test results. So among 3,238 study participants, about 2/3 received a COVID-19 test or vaccination. Sorry, Chrissy, do you mind going forward? One more, thank you. Back one more. Thank you. So again, among our study participants, about 2/3 received a COVID-19 test or vaccination. The most reported reason to be vaccinated was to keep my family safe. Knowledge of COVID-19 transmission was one of the first steps to knowing how to protect yourself. In our cohort, more than half of Pacific Islanders understood COVID-19 can be transmitted by contaminated objects and any infected person, whether symptomatic or asymptomatic. Sources of COVID-19 information among Pacific Islanders varied between community health leaders, religious leaders, employers, and posted information in the community. Most of our respondents, though, learned about COVID-19 through family and friends, followed by healthcare providers and the Department of Health. So ultimately, people's actions often depend on their perceptions of benefits and barriers related to health behavior. For this reason, Pacific Islanders were asked, how likely do you think that it is that you will be infected in light of the current COVID-19 pandemic? Self-perceived risk of COVID-19 infection elucidates one's feelings of personal vulnerability to disease. On an ordinal scale from absolutely sure to no chance, the chances that Pacific Islanders thought they would be infected were even between medium, small, and no chance. For this next session on COVID-19 testing, access, and attitudes, we'll continue to feature responses of the entire 3,000 plus cohort. In addition, we provide responses disaggregated by 6 of our largest Pacific Islander subpopulations, and that is Samoan, Chuukese, Coast Hawaiian, Marshallese, Pohnpeian, and Tongan. Disaggregating race data can help identify disparities among Pacific Islander groups, given the diverse languages, cultural practices, and unique histories. So let's begin with access to COVID-19 testing. 70% of Pacific Islanders agreed that testing for COVID-19 is easy. Next, please. So this is a different graph, but the question is still the same. Is it easy to get tested for COVID-19? Now we want to know the odds of observing a higher order response, like agree or strongly agree, by each ethnic group. Since majority of our sample identify as Samoan, they serve as the comparison group. Here we see that Chuukese, Marshallese, and Pohnpeian were less likely to agree that getting tested for COVID-19 was easy compared to the Samoan group. And this is our first example of how disaggregating race data can help identify differences in attitudes among Pacific Islander groups. Again, given the diverse languages, cultural practices, and unique backgrounds. In the survey, Pacific Islanders were asked if they know where to get COVID-19 testing in their community. Here we found that Chuukese and Marshallese were less likely than Samoan to agree to knowing where to get tested in their community. Oh, forward, please, Chrissy. Thank you. Besides attitudes of COVID-19 testing, we assessed their interpretations of a negative or positive result. So for figure 23, we asked, how confident are you that a negative test result means that you do not have COVID-19? 85% of Pacific Islanders expressed confidence that a negative result means they do not have COVID-19. So this is still the same question, but again, we're looking at responses from specific ethnic groups that were statistically significant or a p-value of less than 0.05. We found that Coast Ryan were less likely to report that they were confident a negative result means they do not have COVID-19 compared to Samoan. Then for figure 25, we asked yes or no. A negative test result means I do not have COVID-19 now. While 75% of Pacific Islanders responded that they were confident or very confident, we found that Chukis, Coast Ryan, and Marshallese were significantly less likely to interpret a negative result as not having COVID-19 now compared to Samoan. Next, we asked another yes or no question. A negative test result means I can be around others without giving the virus to them. While 34% of Pacific Islanders responded yes, Pohnpeian were more likely to interpret a negative result as such. Then for figure 27, we asked if a negative result means I can be around others without getting the virus from them. Chukis were about 1.5 times more likely than Samoans to interpret a negative result as they can be around others without getting the virus from them. So just like investigating interpretations of a negative result, we reframed these questions to find meanings of a positive result. We began asking Pacific Islanders, how confident are you that a positive result means you do have COVID-19? 84% said they were confident or very confident that a positive result means they are infected with COVID-19. And breaking it down into ethnic groups, Chukis were more likely to report high confidence in a positive result to confirm a COVID-19 infection compared to Samoan. For figure 30, we asked, does a positive result mean I will need to be admitted to the hospital? While only 28% of the study sample said yes, Chukis were 4 times more likely than Samoan to interpret a positive as they will need to be hospitalized. We then asked, does a positive mean I will need to isolate myself from others? To which 92% of our participants said yes. However, Chukis were significantly less likely to interpret a positive as they will need to isolate compared to Samoan. And lastly, we asked, does a positive result mean I will need to take off of work? About 60% of Pacific Islanders said no, but we can see the ethnic groups responded differently compared to Samoan. Chukis and Marshallese were almost half as likely to interpret a positive as needing to take off work, but Tongans were about 1.7 times more likely. Then, as Chrissy kindly explained earlier, Pacific Islanders participated in our study through a series of activities. First was the completion of a pre-survey, then voluntary participation in a COVID-19 education session and/or getting tested for COVID-19. And lastly, the completion of a post-survey. Of the study's total sample, nearly half of participants completed both pre-survey and post-survey. Participation in COVID-19 education and testing were recorded as part of our post-intervention survey. So of those who did both surveys, 82% attended the study's education session on COVID-19 testing, and also 70% got tested for COVID-19 since their study enrollment. So in summation, Pacific Islanders are culturally diverse and linguistically distinct. Our observed differences in responses across ethnic groups indicates a need for more targeted interventions. Our findings support the previously mentioned reasons as to how COVID-19 is exposing and exacerbating inequities among these communities. The social determinants of health, like language, socioeconomic status, education, or access to care among Pacific Islanders, directly contribute to the well-being of the community. Health disparities exist between Pacific Islander subgroups. COVID-19 awareness, knowledge, and attitudes vary between Pacific Islander subpopulations. And lastly, there is a need for meaningful data collection, like tracking morbidity and mortality. And there's also a need for quick dissemination of data to influence COVID-19 decision-making and response efforts, as well as preparedness and response for future pandemics. So thank you for listening to our study's findings. We'd like to open the floor for testimonies by two of our field research assistants. Thank you, Pastor Jordan from the United Church of Christ, Pohnpei, and Binasia from the University of Hawaii at Manoa. Thank you very much for your meaningful contributions to this study as community health messengers. So Binasia, may we hear from you first, please?
Aloha and Rananim. I'm one of the research assistants. My name is Binasia and I'm from Chuuk, Micronesia. First, I would love to thank Dr. Yanakihara, Dr. C, and Dr. Talsosi. I also want to thank the Pacific Islanders that participated in our project. Working as a field research assistant has been really helpful for me. I learned a lot and I gained a lot of knowledge and experience from it. I learned how to enter data from the surveys that were collected. I also improved my interpersonal skills because it was very hard for me to approach strangers and ask them to participate in our study. Although it was hard at the beginning, I became better at it overall. I learned the importance of paying attention to the process when checking for the eligibility. I also met some really great people through this study. It was a great experience. There were also some challenges I faced during our outreaches. For example, some people did not want to participate because they thought we were trying to scam them. So they would just ignore and walk away from us. I was surprised when it happened at first, but when it happened again, I had to focus on looking for another Pacific Islanders who would love to listen. The other challenging thing was that people did not want to give us their information, like their phone number for follow-up. Some also refused to sign the consent form. Overall, it was a great experience for me. Thank you so much.
Pastor Jordan?
Yes, Kasalelia, everyone. My name is Jordan Gallen. I'm from Pohnpei, and I'm also one of the field research assistants. I thank you all for being here. And I also want to say thank you to Dr. Tina and the rest of the team for their insightful and very educational presentations. Like most of you, I felt that the COVID-19 was very, very, very tough one. We see people getting very sick, and loved ones or even friends passed away. And so we as a society, Pacific Islanders, we cried out for help. And so with this research, I support this research. We found some relief knowing that there are people out there who are willing to design a project or study to help us Pacific Islanders who really needed help. And so we, like Binasia said, we had some really tough times going out into the fields, trying to get the data and doing the test to minimize the spread of COVID. And so I also thank the participants who agreed and were willing to do the survey and take the test. Without their help, this project wouldn't be possible. On a more positive side, I worked with very laughing and kind people. People like Dr. Rick, Dr. Angela Sai, even the rest of the team from Hawaii. They all went out above and beyond to help as much as they can. One person that I also want to recognize now and say thank you to is Dr. Tina. Dr. Tina is a great example for all of us to follow. She has helped so much people, our elders, even students, and other Pacific Islander communities. So that's what I really feel that's very important to all of us, is the feeling of wanting to help. And so with this research, I think we tried our best to help collecting data and hoping that someday we can use for our future generations for strengthening, whether it be education, health, or even employment. So thank you all so much for your help, and may God bless us all. Thank you.
Thank you so much, Pastor Jordan and Pinasia. Now we're almost done. Study impact. As you see here, in the interest of time, we'll just go over this one. The study was unique, or is unique, because it was based on Pacific Islander health. And I think this is the largest study that was done by the University of Hawaii and also JAPSOM for the Pacific Islander community here in Hawaii. We build a lot of strength and trust-based partnerships with Pacific Islander communities, churches especially. We also work with our Pacific Island students, especially the college students here at Manoa. We provided training opportunities for our students, not only the undergraduate students, but also the graduate students. And we're hoping that they will also try and pursue health-related professions when they graduate. We also build strong partnership, not only with several government agencies, but also community-based organizations. And we hope that this partnership will continue to help the Pacific Islander community here in Hawaii. And for implications, I think this is up to us and everybody who's here today to try and see how you can help this population. There's a critical need for Pacific Islanders to be engaged in the research and healthcare professions. And their Pacific Island communities are highly underrepresented in college education and professional careers that would help them with income that could help this population when another pandemic appears. So we also would like to ask the Hawaii legislature as well as the University of Hawaii to help increase their efforts to advance social economic conditions by providing quality education for this population, the Pacific Islanders. Okay, the next one up is our Vice Provost from the Office of Research and Sponsored Programs at the University of Guam, Dr. Rachel Carrero. Thank you, Dr. Carrero.
Thank you, Tina. Let me see if I can share my screen, my slides. Okay. Oh, I'm not able to share. Let me see.
Camera and Momi, are you guys able to make her a co-host, please?
Oh, okay. Now I am.
Awesome. Thank you, guys.
Okay, so let me just go. All right, can you see that? All right, okay, good. Thank you so much for giving me the opportunity to share just real quickly, real briefly about the Guam part of the project. And it's really hard to follow Tina and the Hawaii team because they did such an excellent job. So I hope I do okay. But I just want to say at the beginning that it was really an honor to be part of this project and to work with the Hawaii team. I've partnered with the University of Hawaii Cancer Center and other segments of UH Manoa. And so this is the first time that I got to work with Dr. Richard and Tina and everybody. And I really enjoyed getting to know you all. And so I just feel so honored to be a part of the project. Just want to introduce the team and really these ladies, they did all the work. So I can't take any credit for what was done. Tio Cruz and Angie Mummer, they really were kind of the brains behind things and getting it done. But then Darian, Ashley, and Nisa, they were the worker bees and they worked so hard. And so I really, my deep appreciation to all of them for their very hard work. And I'm very appreciative to them. So just a little bit about Guam. So Guam is different. The demographics are quite different from Hawaii. This is from the 2020 census data. And so Chamorros, the native Pacific Islanders of Guam are Chamorros. And so they make up 36.5% of the population, followed closely by Filipinos. We have a huge Filipino community here. And then if you look at the non-Chamorro Micronesians, because well, Chamorros they're a part of Micronesia, but if you look at the non-Chamorro Micronesian population here on Guam, which overall is about 12.1%, we have Chukis, Kusrayan, Ponapean, Yapis, Palauan, and very few Marshall Islanders. And then we have some others that in the census data, they're other Pacific Islanders, maybe they're from Hawaii or Samoa or other, Tonga, Fiji, or they're a mix and the census, I guess they didn't know how to categorize. But we do have quite a few Micronesians that live here in Guam. If you look at the impact that COVID had just on the Pacific Islanders here in Guam, if you put all the Pacific Islanders together, they make up 51% of the all of Guam population. And this is data as of December 2022. And so 43% of the COVID cases were among Pacific Islanders and 52.6% of the deaths. If you were to break that down into Chamorros and the non-Chamorro Micronesians, Chamorros, they make up again 36.5% of the population, but they did okay, 32% of the cases and 28.7% of the deaths. So it was pretty proportional. But what's really alarming is if you look at the Micronesian, the non-Chamorro Micronesian population, even though they only make up 12.1% of Guam's population, and pretty low number of cases, they made up 19.5% of COVID deaths on Guam. So you see there's a really a huge disparity in COVID deaths, which, I mean, that's ultimately the worst. So it's a real concern that our Micronesian brothers and sisters, they were suffering the most during COVID-19 pandemic. So if we look at, and this is kind of just another graphic showing that among Chamorros, nearly 3 in 10 people who tested positive for COVID were Chamorros, and nearly 3 in 10 of those who tested died of COVID-19, of Chamorros who died. If you look at Chukis, again, it's just illustrating the fact that among the Chukis specifically, nearly 1 in 10 people who tested positive for COVID-19 were Chukis, and yet nearly 2 in 10 people on Guam died of COVID-19 were of the Chukis population. So huge disparity. They make up a very small percent of the population, and yet they were the ones suffering the most from COVID death. And then if you lump all the non-Chamorro Micronesians together, again, it's pretty much the same. They only accounted for 7.9% of the cases, and yet 2 out of 10, 20%, almost 20% of those who died from COVID were the non-Chamorro Micronesians. So if you look at, so that's overall on Guam. If you look at some of the results of our study, who we were able to recruit, 68.1% of those who we were recruited were Chamorro, then 7.3% were Chukis, 4.6% of our participants were Palauan, 4.2% were other Pacific Islanders, we had a few Samoans, Fijians, then we had Pohnpeians, 2.6%, 2.6% were Yapis, we had a few Native Hawaiians here, and we had some Coast Ryans. So it was mostly Chamorro, but we did have some from the other Pacific Islander groups. We had a very young population, and I thought it was kind of interesting, and I put it by generation just because it's like, wow, 41% were very young people. They were, they're the Gen Zs. 26.5% were that middle, millennial age group. 17% were the Gen Xers. And then 9.6% of our participants were the older 56, older 9 points, the boomers. And then there are a few people who did not answer or we did not know. And this is kind of skewed because if you look at the Guam population, we don't have 41% of our population as being in this age group. It's more like 16-17%, and only 16-17% are that Gen Z. So we kind of oversampled from the younger population, which may impact our results, but it is what it is. And so we had a pretty young population. And then in our survey, we were predominantly 65% of our participants were female. So when we, again, I'm not going to do as thorough a job with the results as the Hawaii team did, but when we asked about some of their baseline COVID knowledge, they had pretty decent knowledge as a group. 79.3% had heard a great deal about COVID already. 78.4%, they felt that they had sufficient information about COVID. 95.3% said they knew that COVID is transmitted from close contact with an infected person. 93.8% said they knew that they can get COVID from close contact with an infected person. And 89% said they knew that COVID could be spread from surfaces touched by an infected person. So overall, the group knew, they had pretty good knowledge. But I think the thing that really kind of caught my attention is if we looked at the data of the other Micronesians in particular, and this is where we see some differences between them and the Chamorro population, is that among the other Micronesians, they were significantly less aware about transmission of COVID-19. They, in particular, they were less knowledgeable about the fact that you can get infected if they were in close contact with someone who had symptoms or had no symptoms. And they were significantly less aware of the fact that they could, that transmission could happen by touching surfaces that were touched by an infected person. So that's something. Another thing is when, among other Micronesians, a significant barrier for them to get tested is that they were concerned about public officials contacting everybody that they had been in contact with. So, and that was, you know, it was a significant odds ratio. So they were twice as likely to be concerned about that. Another thing that kind of struck me is that they were 3.7 times more likely to not want to know if they had COVID-19. And that was significant. So they were significantly more likely to feel that way compared to Chamorros. Also, they were significantly more likely to believe that if they did get COVID-19, that there wasn't much that could be done for them. Finally, they were significantly more likely, 3.97 times more likely to believe that it would be difficult to get health care if they did have COVID-19. So these are some things that, you know, it really touches the heart because they don't want to know. They're more likely to not want to know because these are some real barriers. They don't believe that much will be done for them, and they don't believe that they'll get sufficient health care. So to me, that was really a sad thing to find out. So to me, that's really the crux, and that's really the most important. That's one of the most important things about this project that, you know, we're still in the process of analyzing data, but I think this is really important. And out of everything that we've discovered, I think this is the most significant thing that at least us on Guam that we can share with our, you know, with our legislators, with our healthcare system, with our healthcare community, is that something needs to be done, because if they're feeling like this, then you know, that's a barrier, and we need to somehow overcome this for the next time something like this happens. So I just want to say in closing, thank you so much to our community partners. We and our workers. We had student volunteers who came and helped when we were out collecting data. And we're just really appreciative of them and all of their help, and the community groups that let us come and tag along with them while we were recruiting different folks to be in the study. And with that, that's all I want to say. Just thank you so much. I really appreciate the opportunity to share, and really appreciate the opportunity to be a part of the study. Thank you so much.
Ellie, I think it's the
Okay,
next one
guys.
is about questions.
All right, so thank you so much to, of course, the Hawaii and the Guam team. It was awesome to hear your findings and to see the difference between the two areas. So what we'd like to do now is open it up for questions. There were some questions that had already been posted, so we are going to answer those questions so that you guys can know. So one of the first questions that we had was, can you please describe how the survey was administered? Was it in language? Was it paper or pencil, or paper with pencil rather, or online where they could log in, or did you have an iPad? So I'll let Chrissy and Dr. Tina, if you guys want to take that.
Thank you, Telly, for the questions. When we first started, that was before the lockdown, we translated the study. We have questionnaires in Chuukese, Samoan, Marshallese, Pohnpeian, and Kosraean. And when our our field research assistants went out to the field, it was in person in the beginning, but when the lockdown happened, then we had to do verbal conversations and invite participants to do the online survey. Does that answer your question?
No, that's awesome. And I think the next question that they asked, which I'm gonna the next question that they asked was, what did they get? So what incentives were provided for them, for those who participated in
Well,
these surveys?
well,
And was it the same for here as it was for Guam? Sorry.
I believe so. So in total, the participants, the survey participants were getting about a total of about $70 or $75. It was, in the beginning, we started with $10 per pre-survey, $10 per post-survey, $10 for attending the education, but then we changed because a lot of our people were, the survey was too long, so we wanted to increase the incentive. And also, if you refer 3 people, then you get $5 each. But a lot of the people, some of our participants, they did not want any gift card. They just wanted to participate. So that was great for us.
Oh, awesome. And then for Guam, I'll ask Dr. Rachel, what was your experience? Were you guys able to I'll go back to the first question. When you guys did the surveys, was it in language? Was it paper, pencil? Was it computer? Was it iPad? And then what incentives, if any, were provided to those who participated?
So we had the same incentive structure as Hawaii. So what Tina mentioned for us, and I think Tina will probably agree, is we tried to initially do recruitment because we were on lockdown, do recruitment through, flyers and electronically, but really you got to make that personal connection, even if it's talking, hey, you don't know anybody, but you have to make that personal connection. And then once they say yes, then they're more than willing. And we did pretty much everything online, and they liked to do the survey online because it was more at their convenience. But to initially grab them, to get them interested and willing to be in the study, there had to be that connection face to face. And so we would go through periods of, when it was locked down and you couldn't, the stores were closed, there was nothing going on. And it was a lot of just personal connections, like, okay, so-and-so is going to do this. But once we could go out in the community, then, going to the malls and trying to do things to recruit people, the face-to-face really was the key.
Awesome. And this is a question from our FB, those who are watching on the FB Live. Was there anything that you folks, either here in Hawaii or in Guam, found out about the communities you served through this initiative that you didn't know before? So what was significant to you guys? And I'll have, Rachel, since you just finished, I'll have you go first this time, and then we'll go to Dr. Tina.
Well, this was a kind of a new project for me because I'm a nutritionist, and so this was I learned a lot. And I think the thing that really just was so heartwarming for me is that these other communities, they just really care so much about their community, and they're very committed. And, they're so open to helping each other and helping, we think that we're so good and we're going into communities to help them, but they're the ones that they're willing to help us. And that's the thing that just really was wonderful, is how we reached out to a few groups and they said, oh yes, and they just helped us. So it was really, it was such a nice kind of a give and take. They gave us so much. They helped us so much. I think I knew that, but just to see it again, it was like, oh, so nice.
Wow, that's great. And then Dr. Tina, you and your team, what do you guys?
Totally agree with what Rachel has said. The community were willing to help. The community was there for us. But one thing that stand out for me was that I was very happy that they kept asking the question, what are you going to do with that data? What is the purpose of collecting? Some of them were saying, we've been researched too many times. What are you guys going to do with this research data? So I think that's heavy on us, on our side, to see what is the university and this state going to do with the data that we collected.
I think that's awesome. Anyone else from the Hawaii team want to add to that? Like, was there something that you guys learned that you didn't already know? Chelsea, Chrissy, Pastor Jordan, Elizabeth, anything else you guys want to add to that?
I can say something real quick. One thing that always comes to the forefront of my mind is moments when I was out in the field with Benasia. At first, I knew language was a huge barrier to even understanding COVID-19, but in order to reach out to people, like at Ala Moana Park, for instance, when I would approach of Chuki's families, they would kindly say no, but I would call over Benasia and just ask her to represent the team for us, and it was like night and day. At first they kindly said no, and then as soon as Benasia came in, it was almost as if I was family. Like they were giving me their babies to to hold on to while they did the survey or something. So that was really humbling and heartwarming, and that just really resonated with me. Thank you.
Oh, that's awesome. I think along those lines, there's a question that we have, and it says, as someone looking in from another culture or race, Hawaii is one of them. Hawaii has diversity that they don't find on the continent. And so when we're thinking about that, and also we understand, because one thing that I thought was important from your presentations from both Hawaii and Guam was the need to recognize that the Pacific is not monolithic. We are diverse. Our languages are different, our cultural practices are different, and lumping us together or assuming that we all speak the same language or have the same culture is not beneficial. So my question to all of you guys would be, and whoever wants to take this, go ahead and jump in, is you guys have that understanding. How do you see people then coming together in order to bridge those gaps or the diversity? And also, how do you share this knowledge with others? Because again, many Western-centric methodologies as well as research practices assume that we're all the same. And if you come up and you ask somebody something in English, that's all you need, or you don't need to be cognizant of culture. I hope that made sense, guys. So anybody want to tackle that question? I know it's a difficult one, but I feel like it's one that we really need to think about and engage with, especially in this era of decolonization, equity, representation, and creating equity among knowledge, right? There's not indigenous knowledge and Western knowledge or academic knowledge, there's simply knowledge. So guys, based on your experience, how do we address all those very complex and nuanced and difficult issues? Anybody want to?
Hi, this is Liz. I just wanted to share that, as a team here in Hawaii, I felt like all the subgroups were represented, at least most of us were, but when we came together as a team, it kind of helped us to diminish the fact that you were Pohnpeian or you were Chukis and I was Samoan as we continued to work together. And I feel that that is exactly how we should be working as Pacific Islanders, that we don't see languages, we don't see cultures, we don't see, our personal bringings that we bring to the table, but we come together as Pacific Islanders. We still have our values, and from what I learned here is it was just so much respect for each other's communities and for those who we work with. The population we work with, they were, they might be low income, but we didn't see that. I think we did it. We're such loving people, and despite the turbulent times that we're going through, everyone came together. If I didn't know something, I would reach out to my Marshallese sister who was able to work, and when the community saw that, it was easier for the job to be done.
I'll just add that I think that one of the things that we need to do from a scientific perspective is that we just have to keep publishing our studies, and we just keep having to get the word out, and the more we publish our work in scientific journals, I know that but we got to get it out there so that there's more and more information for people to learn about it, and just to know, and because we might all understand, but to get others to understand, we just have to keep publishing, and it's hard. Nobody likes to do it, but we just have to keep doing it.
Tilly, I just
And
wanted
maybe-
to share, I think that was one very important thing about the study and the research was these subgroups were taken out of being clustered together with the Native Hawaiians or the Asian Americans. So we see from here that we can do this. We don't have to be under somebody's umbrella, that as subgroups and Pacific Islanders, we can stand on our own and we can make something that will be beneficial to our people.
Thank you
I
so
maybe
much.
just want to add on to what my team here said, and also Dr. Rachel, is that I totally believe that this study would not have been successful if it was done by any other race and not Pacific Islanders. Because of the language, the culture, and because I think this was a very passionate team that really wanted to do something very important for the Pacific Island community. So I think for the university and any other researchers and funding agencies, I think you should put the money into a lot of Pacific Island nonprofit organizations if you want to continue this work. You have to lift up this population because you cannot do it. It's very different. It was very challenging. But if there were non-Pacific Islanders, it would have failed. Because this is not just knowledge, this is really your heart putting into this study, because we all believe as Pacific Islanders, this will probably help this population get out of poverty by using the data that we've collected.
That's awesome. Is there anybody else who wanted to add to that? Chelsea or Chrissy? You guys. All right. So all of you guys have made note about how important this data is. We have several questions asking, when will this data be made available? Is it going to be published? And if so, where? And that is inclusive of both the Hawaii study as well as the one that was done in Guam.
For Hawaii, definitely, that's the focus. We're working on community reports, and the reports will also be available on the website. But at the moment, we want to reach out to the Pacific Island community first. We want to share the data to the people that responded to this study. And then hopefully before the end, maybe in mid-June, we should have a report available, but we're still continuing to produce reports to different, we have to present to the RADx-UP team as well. But the report, yes, this is for everybody to take advantage of. Thank you.
So for the Guam data, I'm actually working on the manuscript for publication. We're hoping to get it done by May and get it submitted. And then I think once that's submitted, then we're going to also do our community report, and we want to do that and submit it to our legislators and to the whole community, and then do some presentations kind of like this, but open it up for the community here in Guam to share our results.
That's awesome. We appreciate that, and we look forward to that, and we'll make sure that if we can cross-post it or help to get that information out as the NHPI 3R team, we would love to be able to share that on our site as well. So just keep that in mind. you guys all brought up the number of deaths that were experienced by Pacific Islander communities, whether it was here or in Guam. And one question that is saying is, or that was posted is, obviously Pacific Islanders were and still are mentally affected by the COVID-19. Given the findings of your study, how will you extend the study to address the issues of mental health affecting Pacific Islanders, both in Guam and Hawaii? And I would like to add to that question, because we also know that there's a large number of Pacific Islanders who are experiencing long COVID. And do you have any plans to continue surveying or to continue the study and expand it out into long COVID? So if you guys don't have an answer, that's fine, but just thought we'd put it out there. So Dr. Tina and Dr. Rachel, if either of you wants to start or take that question.
That's a great question. Thank you for asking that. Well, we're going to take it back to Jackson. We're going to take it back to Jackson. They have the medical professors there, and hopefully they will provide something for mental health and long COVID. Thanks.
Yeah, and I think the thing about COVID is that it really affected the mental health of everybody. And I think especially our young people, there's a segment of those high school and college students who, they spent the last 2 years of high school, in their room in front of a computer and had no social interaction. And I've seen this, my own daughter, who she did her senior year and her first year of college, and she feels like she doesn't know how to interact with people. So I think it's a very pervasive problem, not just among Pacific Islanders, but I think that they probably have a disproportionate number of folks who are dealing with depression. And here on Guam, we have a very, very high rate of suicide. Anyways, one of the highest rates of suicide across the nation. And so it's a really, mental health is not my wheelhouse, but it's, I think it would be very important and very impactful if we could see the impact that COVID has had on mental health, long COVID, and just because I think it's we're not done yet. The virus might be gone, but the long-term impacts are, we just really don't know yet.
No, thank you both. Another question that has been posed, and I find this to be something that even I'm having to deal with as I sometimes pretend to be an academic, is what methodologies can we highlight in order to further this research? So I know throughout the Pacific, we hear a lot about Talanoa, which is a Pacific framework, as well as here in Hawaii, they have something similar. It's called Talk Story. So as you think about, how you were doing your research project and going out into the community, one thing that I heard made mention of was respect. Another thing was language, and another thing was culture. So my question to you guys would be, if you were to give anyone advice for working with Pacific Islander communities. Also, I do want to say you also had diversity in your staffing, which I thought was amazing, because that way, like in Chelsea's example, as a Samoan, she went up to the Chuki's family and, they were hesitant because they didn't know her, which then she was able to call on her Chuki's counterpart and have her come up, and that created that relationship, which allowed for a meaningful engagement, but also a collection of more data, correct? Which is what we're always missing. So with that understanding, if you guys had to give advice to someone who is going to go out and do research among Pacific Islander communities, what would that be? And whoever wants to take that question, I'll open it up for you guys?
May I answer it? Because it's also kind of related to the mental health issue question. So thank you for that question. I'm not too sure if our methods of using questionnaires and surveys was enough to really address mental health issues among Pacific Islanders. We do have a question where we ask if they do suffer from mental health issues or depression. But I think what Telly was saying about doing talanoas and focus group discussions would be most appropriate if I had to redo this study, just because when I talk to, our participants, they use different ways of expressing mental health. And I do feel like we get a lot more in-depth information when we talk to people, and it's just a better approach, I think, for our people instead of just giving them a piece of paper to express themselves. So that's how I would do this again. Thank you.
Telly, I when you asked that question, I'm thinking of, they say, do as the Romans do. When you're in the house of the Chuukese, learn their language, learn their culture, become one of them. We have to go down to their level. We don't go in as master students or doctorate students. We are Pacific Islanders. We go in as, family. We do the Ainga talk, the Falelenga to bring them out. I was just thinking of how they do photo voice. I think that's another method because it would be more comfortable and more in depth for them to come from where their inner depth to share. But one thing I really learned in this is the importance of awareness for the communities. And through the data might be small in number, but I feel like it's an awareness and it's gonna create a lot of beneficial things for our communities and for the people, because even when I went out, I felt like I was snowballing, because through one person that I knew, my extended family and relatives were able to be interested in the study. So we use our connections, because that's how we as Pacific Islanders learn from the past, was through the word of mouth by our ancestors. We have to go back to the basics of our culture to be able to meet the needs of our people.
Can I just add something too? As so I'm half Chamorro, but I inherited the white skin. So this is an issue that I've been dealing with all my life. And what I found is that if you just, no matter which group you're working with, is just treat everybody with respect and kindness. And they're just so quick, they will right away reciprocate. And I think that's just the way of our cultures, is that, you treat them well, they're going to treat you well also, and just be humble. And so for folks who, maybe they're not Pacific Islander and they want to work with these groups, just don't put yourself on the pedestal, but just be kind and just be humble and just be respectful. And people will just open their arms to you and they'll share.
And I wanted to add a little bit
Yes.
about, is that okay, Telly? Is that especially if you're not Pacific Islander or not familiar with the culture, sometimes yes means no and no means yes. And the importance of learning about their cultural practices and cultural values. When you go and visit, you have to take something. And I think especially for those who are preparing funding proposals, you have to include in there that there needs to be money for food. Food will bring the Pacific Islanders to the table. And we have to respect that as researchers.
Always being aware of reciprocity. That is the language of the Pacific. So thank you. Okay, we have a few more questions, but it's actually, I'll ask one more question. I know we're getting close to time because it's already 1:26, but there was one question that says, is there a way that the study can be done with other Pacific Islanders as well? So it kind of goes back to that first question, but instead it's focused on Pacific, because of course we know that this was a study that was funded by the US federal government. So we stayed within United States affiliated Pacific Islands. But if we wanted to expand that out into the Pacific, what would be the best way to do that? And how could we create those collaborative partnerships? Which is just a thought.
I think this study would have been much easier if you do it in American Samoa or Chuk, Ponape, because people know each other. The difficulty for us was that we didn't know a lot of the Pacific Islanders here in Hawaii, but it would have been much easier. But at the same time, I think Talanoa, this long survey, a little bit too long for a lot of people, but if you Talanoa with the people, you will get a lot out of it. But you can still use the method.
Very, very true. Anybody else want to add to that as their closing thoughts? All right, so I just want to say thank you so much. You all have reminded me of the work that was done during COVID-19. This makes me choked up because being part of the COVID-19 task force here in Hawaii, specifically for Native Hawaiians and Pacific Islanders, we saw the cases and we saw those who passed away. So it's good. Oh man, sorry guys. It's good that we're doing this work because we need to address these health disparities. We can't continue being the most overrepresented groups. And we see that in communicable and non-communicable diseases. So hopefully, as we gather more data, we can create better strategies, but also we can start chipping away at those health disparities and inequities that our communities continue to suffer, and we can normalize living longer and living healthier, because that's what we want. We want to be there for the next wedding. We want to be there for the next graduation. We want to be there for whatever small things or big things that are happening in our communities. So, mahalo to all of you guys for all of your hard work, for opening yourselves up, for putting yourselves out there for the community, and for doing the heavy lifting. So thank you guys so much. I also want to share with you guys that we will be having on March 30th, for those who are interested, a discussion on long COVID. We will be providing more information going forward, but we just want to put this on your radar so that you're aware of it. And then, of course, mahalo to Papa Ola Wakahi, to the NHPI 3R, and to all of our affiliate and organizations for their support. Without all of you, it makes it really difficult for us to do this work and to move forward. And I want to remind everyone that it is through your work and the representation of your communities that we're making changes. We're bringing our issues to the forefront, we're advocating for policy change, and we're making a difference. So thank you, thank you, thank you. Mahalo for all of that. Does anyone else want to add anything before we call it a day and let people get back to work? I know it's been an awesome hour and a half, and we have enjoyed all of the mana'o and tofa that has been shared here. Tina? Chrissy, Dr. Rachel, Chelsea.
I just want to say thank you everyone for being here, and just 2 actions to get into the community ASAP would be a big smile, and just say, I need your help.
That's awesome. Thank you so much, Chrissy. All right, well, with that, we're going to end it. Thank you so much for spending your afternoon with us or your lunch hour, and we wish you all the best. Mahalo, mafaftai.
Oh, thank you, Charlie, and everybody. Thank you, Rachel.